Hi all, good afternoon. I wanted to speak for a couple minutes on what I'm hearing from patients when I do a complimentary consult for a stem cell IV or injection. There are seminars going on, and this is where you go to maybe a room in a hotel, some kind of conference room. There's a bunch of people there. They're sending out mailers, so you get a mailer at your house. You go to a seminar. So this patient last week, she lives in Oregon, and they quoted her $30,000 for just 50 million stem cells. That is a lot of money. And it's a very interesting, unprofessional process that they put you, the patient, through. This is a medical treatment. So maybe church gatherings or something, but we're talking about a medical treatment. It's unnatural to go to this seminar and then have someone come to your house. That's not how medicine works. A complimentary consult, one-on-one with the doctor, whether that's in person or on the phone, that's always been done in the history of medicine. But why is the marketing people coming to your house? And why haven't you spoken to the physician? And why are you not even seeing the doctor ever? So you get this marketing person coming into your house, going through the financials and the numbers. Again, still haven't talked to a doctor about your case, your medical case. And then you go to the clinic and it's a nurse. Actually, no, the nurse comes to your home. You don't go to a clinic. It's a traveling nurse from out of state that comes to your house to give you the treatment. So this is not practicing medicine. This is a marketing hype, something. And I can't believe that patients would ever sign on to this. Don't do that. You should be talking to the doctor about your case and getting a treatment plan and pricing directly, verbally and in written form. No one should be coming to your home. You shouldn't be going to conferences and hotels and things like that. And then a new patient evaluation is then scheduled, a longer visit. So the complimentary consult is just, what's the medical condition that we're treating? Okay, it's indicated for stem cell therapy. Make sure you don't have a current cancer, which is contraindicated. So just cover the very basics, doesn't take that long. Get the pricing, the treatment plan. This is how many stem cells you're getting. This is all the information you should understand, informed consent, things like that. Then you get it in written form, and then you go to a clinic. So you travel to me and come to my clinic and come to my office. Now, I do offer mobile visits for immobile patients. So sometimes I will have patients that are very ill, and myself, it's not someone else. I go to the home. So you're always meeting me, the doctor, in person for the treatment. It's not a nurse or nurse practitioner, and the doctor just has a sign on the door as a medical director. So I'm always the one pushing the stem cells in you, and I'm the one who's following up with you. It's not a front desk person or a nurse. So I think if you're going to spend $30,000, it should be a relationship. I have a 6-month relationship with my patients. That's half a year, and I'm nowhere the cost of $30,000. Trust me. So way less. And because you're just paying for stem cells, you're not having to cover the cost of conference rooms and traveling nurses and marketing people to come to your house and check out your living room. That's a lot of overhead that you're not trying to get. You're trying to get out of pain. So I just wanted to speak to this new thing that I'm hearing about from patients, and I hope I can catch more patients that we're getting ready to sign the bottom line and save them thousands of dollars and get a legitimate treatment in a medical office with a physician. So go to my website. You can get a complimentary consultation if you're ready to, look for a stem cell and joint injection or IV. I do both. And IV, intravenous, is for inside the body, systemic conditions, autoimmune, psoriasis, irritable bowel disease. Joint injection is it's for the individual joint, knee arthritis, shoulder arthritis. I do neck and low back as well, hip. And so there's only 2 ways to administer stem cells, and there's not enough evidence for intranasal. I can talk to you about that during the complimentary consultation. not enough evidence to prove that that's a viable way to administer stem cells. So hit the button on my website to fill out the survey, and you'll get a call within the same business day, and then very soon you'll be on the phone with me.